Every human death from rabies could have been prevented if the correct measures had been taken shortly after the individual was bitten by a rabid animal. Yet worldwide there are still 59,000 deaths and possibly more from this horrific disease, and about a third of these occur in India. 10 years ago, concerned by the poor use of intradermal vaccines and the lack of availability of rabies immunoglobulin, Dr Omesh Bharti, who's with me now, took important steps to simplify and improve rabies prevention in Himachal Pradesh in northern India. This has led to a dramatic fall in local rabies deaths in and around Shimla through work that has recently been recognised by an Excellence Award from the Indian government, so-called Padam Shri. Every chain will break at its weakest point, and this applies to rabies prevention. Inspired by these results in Himachal, the WHO has recently taken steps to improve and simplify its post-bite guidelines. Supported by Bharat Serums, I've come to Shimla for a week to record at first hand the practical measures being taken in the clinics and by the local government. We hope this film will help the WHO achieve its declared goal of eliminating human rabies as a major health problem by 2030. Dr Bharti, what are the three important measures that should be taken when somebody's been bitten by a potentially rabid mammal, such as a dog, cat or monkey?
So David, three steps that are important is wound washing. We should wash the wound with copious amount of water, soap and water, maybe for 15 minutes, so that all the virus is washed away and remaining virus is neutralized by soap. And then we can put any local antiseptics or any alcoholic preparation to neutralize the virus. The second step is to inject local infiltration of immunoglobulins into the wound, so that any traces of virus that are still there, they are neutralized, because the vaccine takes 7 to 10 days to be effective, and this window period of 7 to 10 days can be life-threatening. So it is there that equine immunoglobulin is important to save lives. And the third step is vaccination, that we do intradermally 3 shots on day 0, 3, 7, 0.1 ml on both deltoids, and I think it's equally effective than any method of giving a vaccine intramuscular.
So let us now see these methods applied in a series of patients bitten by potentially rabid animals in the context of a busy emergency clinic at the DDU Government Hospital and at Indira Gandhi Medical College in Shimla. You'll see that these measures are quite simple, but require dedicated trained staff, as well as commitment of resources by local and national governments and of public education. And we're very grateful to the patients who allowed us to film them. We now see post-bite rabies prevention put into practice by Sister Niramal Gupta, and she follows a strict routine. Our first patient is Manju, who was bitten yesterday by an unvaccinated puppy and probably would not have come if treatment had not been free. Where appropriate, first the skin is cleaned with alcohol and booster tetanus toxoid is injected IM. Then, without skin cleansing, 0.1 ml of rabies vaccine is given intradermally into each deltoid area. Finally, the appropriate volume of rabies immunoglobulin, judged from examining the wounds, is injected around the edges as if she were injecting a local anaesthetic. It's important not to be lulled into a false sense of complacency over small puncture wounds, which from a rabid animal can be just as fatal as larger wounds. You will see that Nurse Gupta is obsessional in searching for them. Often as little as 1 or 2 units of E-rig are needed to cover such a wound. Devi, aged 67, was jumped on by a monkey last night and has a wound on her back. Monkeys and dogs fight a lot over food, and monkey bites in Himachal are on the increase. There have been rabies deaths from monkey bites in neighbouring states. Rash Praj, aged 25, demonstrates how to test in a scratch or bruise whether the skin has broken, and so whether RIG should be injected locally. An alcohol swab is applied, and if it stings, it means the skin is broken.
No skin is broken. That is the precaution we should use. That is 0.025 ml.
Kishan, whose mother is Nepalese, is aged 4, and yesterday he was bitten while trying to play with a pet dog.
Very good.
Note that he doesn't feel any pain from the intradermal vaccine. Although the injection of RIG into the wound causes him some transient pain.
Very good.
He will return for further vaccine on days 3 and 7 under the short and practical IPC regime introduced in Cambodia. This 65-year-old lady was bitten on the ankle by her unvaccinated pet dog. She's attending for the second dose, day 3, of vaccine. Note the redness at the site of the first intradermal inoculation, which is consistent with a good local immune response. Nurse Gupta does not clean the skin with alcohol, as this may inactivate the vaccine. This 44-year-old labourer was bitten on the left thigh yesterday morning in an unprovoked attack by a stray dog. He's unsure of his immunisation status and so will get a full 3-shot course of intradermal vaccination. Many of the patients we saw were poor and wouldn't have come to the clinic at all if treatment had not been offered free of charge. This is an important lesson for governments all over the world.
So very small scratch is there. She is covering that also.
Small scratch above the main one.
Yes.
This 21-year-old woman had a cat bite on her hand. She'd not been previously vaccinated. The wound has been inoculated 3 days ago and she's come up for her second intradermal vaccination. She's very well dressed, obviously, for intradermal vaccine. This young girl was attacked by a monkey in the school playground this morning and has been sent to the clinic by the teacher. She has not been previously immunised and has 2 small puncture wounds on the leg that need to be infiltrated with very small volumes of RIG. This lady has a puppy that the veterinary hospital had refused to vaccinate, and 3 days ago it bit her. At our first visit, 2 other wound sites were inoculated with RIG, but it seems that the hand was missed. Wounds can be infiltrated for up to 7 to 10 days after an animal bite, but obviously the sooner it is done, the better. Zuyota is age 17 and was bitten by a monkey 2 days ago at night and came up and had the main wounds infiltrated, but believes that one was missed, so she's come back to have that done at the time of her second intradermal immunization. This man has skin-penetrating bites, but as he has been previously vaccinated against rabies, he doesn't need any rig, but simply a single 4-site booster vaccination with 2 shots of 0.1 ml over the deltoids and 2 over the scapulae. Ria, who's aged 21, was bitten on her right leg by a stray dog and has 2 small wounds which need around 0.2 ml of equine rig. Vasu is aged 21 and 3 nights ago he was bitten on the right hand and arm in an unprovoked attack by a stray dog. He had his first injection of intradermal vaccine then, and now 3 days later has come up to the pooling centre DDU hospital for his second dose of vaccine and for injection of the now healing wounds with a total of approximately 0.3 ml of rig.
Yes, one injection was at...
So you've been immunised in another clinic, have you?
No, here only.
Once again, note that even the smallest wounds, which may need as little as 1 unit, are injected. And that's... So this is your first visit, is it? Second.
First was here only at around 10:30 p.m.
Right, so you didn't... There was no... Was it in the evening?
Night.
No. Was it a pet dog? Or
Stray dog. Stray dog.
stray dog? Midi was attacked without provocation 1 hour ago by one of a pack of aggressive stray dogs, which bit a hole in her leggings and caused extensive lacerations over her thigh. The wounds have already been thoroughly washed with soap and water, followed by betadine, and traces of betadine were then washed off with alcohol and the skin allowed to dry. To instill the immunoglobulin, Nurse Gupta advances the needle below the skin with the bevel upwards and then slowly injects rig sufficient to raise a pad along the wound margins as she withdraws syringe and needle together. Diffusion of the rig should effectively neutralize any virus in or around the wound. The patient is told not to rub the injection site. Note also that Nurse Gupta does not neglect even the smallest puncture, but she does ignore scratches where the skin has not been broken. Nearly over.
बस हो गया तो थोड़ा सा रह गया बस थोड़ा सा रह गया थोड़ा सा हिम्मत रखो जरा
How's the one, little one? I'm going to
बेटे हो गया हो गया। देखो तो सही आप कितना अच्छा लग रहा है लेटा के। वहाँ तो बड़ी वो होनी थी इरिटेशन। बस 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 बस। बस बस तो थोड़ा सा
Finish?
नहीं, थोड़ा सा रह गया इधर से।
Has to do. You can get a picture of her.
बहुत छोटी नीड है।
Okay. Right. Okay.
Hina got a large bite on the leg by a stray dog a week ago. That day, after wound washing, she was given a tetanus toxoid booster and then the first shots of intradermal vaccine. Then a total of 1 ml of rig was injected around the wound, and after half an hour after inactivation of any residual virus, the wound was closed with a series of individual loose stitches. She has come up for her third dose of ID vaccine. On examination, the wound looks quite healthy now. In this deep flesh wound, we see the sort of technique that would have been used on Hina. Stitching should be minimal and only done after rig has been injected around the edges of the wound and flowed into the wound.
It is very encouraging to see that the WHO new policy on immunization against rabies is being taken up on a day-to-day level in the clinic in Shimla. It's one of the first in the country to use this cost and dose-saving strategy for both vaccines and rig. So using a much shorter schedule for the vaccines and also wound-only infiltration of rig reduces the cost and addresses a very weak link in post-exposure prophylaxis and the treatment of bite victims.
Omesh, before talking about the individual clinic procedures, what difficulties did you encounter in the early stages and how did you overcome them?
See, we were in a situation where immunoglobulins were not available in the market, and some of the people died because they were not given immunoglobulins. So the question was, we had two options: either we don't do anything, or we do whatever we could do minimum possible. And minimum possible was to inject the wound only with immunoglobulins and distribute the remaining immunoglobulin to other patients. So we finally decided to go for local wound infiltration only.
And did you find any difficulty coming to that decision?
Yeah, everybody was agreeing for that, but for doing any deviation from the procedure, you have to take ethical clearances, you have to take technical clearances, feasibility of the study. So that took a long time to accomplish all these technical things.
So this was counter really to the current WHO guidelines, was it?
Yeah, it was construed as working against the ongoing WHO guidelines. But in fact, it was the only life-saving step that option was available to us.
So what effect has resulted from injecting every wound at the same concentration of rig?
Yeah, same concentration, because we can't alter the concentration of the given biological. So that's why we have to inject the same concentration in every wound. But I think that also helped because mostly the injection of the wound depends on the diffusion. Sometimes like scratches or like some parts around the wound where the injection has not gone. So it's better to have a higher concentration, or it is better to have given concentration than to dilute it.
Yes.
Yes.
And have you noticed any harmful effect in not giving the residue IM, which was the previous guideline?
No, rather some of the people, those who came to our clinic on day 3 after getting entire dose of immunoglobulin intramuscularly in the gluteus region for day 3 injection, and we took the serum of those people and got it tested, and surprisingly on day 3 there was only traces of immunoglobulin in the blood.
What effect has resulted from introducing the simple WHO approved IPC regimen for active immunization that we saw used in these patients?
See, nowadays, as you know, there is a lot of crisis of vaccine shortage. So the major impact that we have felt in our clinic is we have saved thousands of vials by omitting one dose of vaccine on day 28, and by adopting IPC regime in our clinic and in Himachal Pradesh.
Mm-hmm. And how did you manage to extend your protocol to the whole state of Himachal Pradesh?
See, there was a situation that in the entire Himachal Pradesh, only our clinic in DDO hospital was giving immunoglobulins, and people were being referred not only from the other centers to our clinic, but from medical colleges to our clinic. Mm-hmm. So then slowly they realized that why don't we start doing only local infiltration. So slowly they adopted our method and spread from one center to another and to the medical colleges. For that we gave them the trained the manpower, how to do it, and then slowly it was adopted by everybody in the state.
Mm. And has it been possible for the state government to pay for the rig?
Yeah, now it is free, and the state government is giving all the biological free. That is possible because the total expenditure of giving 3 doses intradermal plus only wound infiltration of immunoglobulin costs ₹350 rupees. That means $5. Earlier we used to have only one single IM dose of vaccine for $5. Right. So that's how it has, due to price has come down, and the government has been able to afford the price.
Right. And how are your nursing staff taught to estimate the volume of rig needed for each wound?
See, since my nursing staff and I have worked in minority, so we give local anesthesia. We have already been trained for local anesthesia, and local anesthesia, we estimate the volume, how much is required to anesthetize a particular portion. So based on that experience, we tried to estimate the size of the wound, and then estimate the volume of the immunoglobulin that need to be injected, and if we require more, we take another syringe and we give additional dose.
Yes, but it's important, especially in some sites like fingers and toes, not to give too much, presumably.
We actually don't give too much. We give only that much, that as much is required to cover the surface of the wound.
Yes.
So sometimes, like a monkey has put a small puncture wound in the finger, it required hardly 1 unit of immunoglobulins. That is 0.025 ml, which is just 1 unit.
And of course, rabies can develop from very small wounds.
Yeah.
So how do you rate the old WHO guidelines with the new one?
I think new guidelines are very cost effective, and at the same they're time saving to the patient. In the sense, like old protocol was, we were giving antigen and antibody at the same time intramuscularly.
And the patient acceptability?
Yeah, it is. The patient is very happy because earlier there was a lot of reaction due to intramuscular immunoglobulin and a lot of pain also. So I think now the pain and reaction is almost negligible.
It was certainly striking, that little boy we saw in the film. No reaction to the intradermal, and very little, really, very short-lived to the rig.
Yeah.
What do you see as the best way to scale up the Himachal model of human rabies control to the whole of India and indeed worldwide?
I think we need to, first we need to train the people how to give the intradermal injection, and second how to give local infiltration of immunoglobulin. That I am very sure that this film is going to be of lot of use for others to learn. And then another step that I think that we have taken, and that is pooling of the pooling centers. That means peripheral centers, when the dog bite patient come to them, they give the first aid, wound care, and then they send the patient to a centralized place that we call as pooling center. So there are a lot of patients in the pooling center, thereby helping us sharing vaccine vials and immunoglobulin vials. So the sharing is important to save the costs.
Yes, and we saw one or two cases in which they had the vaccine and then 2 or 3 days later came up for the second dose and RIG was given then.
Yeah.
How long is RIG effective?
See, we should, after wound wash and vaccination, we should give immunoglobulin as soon as possible. But we can give it up to 7 days, and we can see in the movie that even if somebody has missed some wounds that has not been infiltrated with ERIC, additionally we can treat those wounds with local infiltration of immunoglobulins.
Yes. And in your opinion, is it important to provide this treatment free of charge to the patient?
Yeah, that's very important, and we didn't tell the government to make it free. But when they realized that it's such a low cost effort, that they themselves decided to make it free.
Yes. In the light of the recent tragic death of a Norwegian woman who contracted rabies in the Philippines, what do you think is the message for travellers?
See, the woman was bitten by a pup, and I tell you, in very small state of Himachal Pradesh, our state, we have seen 5 deaths due to pup bites or scratches. So, I would say that the notion that we should not immunize pups below 3 months is driving people towards deaths due to rabies. And even WHO says that whenever we bring home a pup, we should vaccinate the pup, then we should vaccinate at 3 months, and then we should vaccinate the dog every year. So I think that message should percolate not only to the common man but to the veterinary people also, so that in rabies endemic countries they vaccinate pups before they are brought home, even if they are 3 months below.
Right. And what about immunization before you go to a rabies endemic country?
Yes, certainly we should get a pre-vaccination, and if you are very short of time, at least you should take 1 dose of vaccine, and second dose can be as per the latest WHO guidelines. You can take second dose anytime before 1 year, and full course, of course, if bitten by any pup or dog bite.
So a single dose could be IM or intradermal?
It can be both.
Yes, but important to have at least a single dose,
Yes.
and preferably a full course.
Yes.
Otherwise, you have a lot of problems in many countries with lack of availability of RIG.
Yeah, definitely.
And that was obviously the case in her case. Since your method has been extended across the state, what has been the effect on rabies deaths, do you think?
See, if, we had made vaccine free since 2008, when we shifted from intramuscular to intradermal, and since 2014 we have shifted from intramuscular immunoglobulins to only local wound infiltration, and that's why both the biological are free in our state. And that has resulted, as you saw in my clinic, the poor people availing the facility even if they get a scratch. So that is very important, and for the last 1.5 years we have not seen any rabies death due to this protocol being followed. Only exception is only one case of a girl child that was bitten on the face by a rabid dog, tearing off her nerve and muscles on the face, and she could not be saved despite being given the prophylaxis.
And she hadn't had particularly good wound washing, I think.
Yes, surely. The parents have not washed the wound and they have not applied an antiseptic. They waited for 17 hours to go to the hospital. I think that has probably contributed to her death.
Yes. What are the main mammals responsible, and when are people most at risk of being bitten?
See, in Himachal Pradesh, we have done a death review, and 99% times we have seen the dog bites and pup bites have contributed towards majority of the deaths due to rabies. Some deaths have been reported due to cat bites, and some deaths have been reported due to mongoose bite. We have found a monkey positive by laboratory for rabies, but deaths due to monkey bite, though not reported in Himachal, have been reported from neighbouring states of Haryana, Delhi, UP, even as far as Tamil Nadu. So I think monkey is also a potential source of rabies in our state. So that's why we immunize people for monkey bite as well.
Which pet animals would you recommend owners to immunize and when?
As I said before, I think before we bring a pet home, even if the pet is at birth, we should immunize the pet. It has been proven there is no antibody interference, maternal antibody interference when we vaccinate the pups below 3 months. That has been proven, and then we should vaccinate the pup at 3 months and then every year. So that is the case of pup. And I have seen that many of the people who have pet cats, they don't think a need for getting cats to be vaccinated due to by anti-rabies shots. I advise that we have deaths due to cat bites, so I think we should definitely immunize cats against rabies.
Right. So, and finally, what is your main take-home message for viewers of this film?
See, there are different models being given by WHO for rabies control, but I would see that another model in rabies endemic countries like ours is low-cost prophylaxis that we have shown has resulted in almost bringing down the death due to rabies to almost zero in our state. So I think this is a very good example of scaling up to the country and to other endemic countries. This method is low cost, this is doable, and before we think of other methods, we should replicate this Himachal model in other states of our state, our country, and I think in other countries to fulfill the WHO objective of eliminating human rabies by 2030.
It's also amazing the throughput in your clinic in DDH hospital. So it doesn't require enormous manpower, it's logical, the patients understand it, and they seem to come back.
Yeah, definitely.
Thank you very much.
We would like to see this multiplied in many more clinics, not only in India, but in many other places in the world. Again, it saves not only money and doses, but it saves lives because we can reach many more people. So we hope to multiply and scale up this same similar strategy in other countries in the world that have a big burden of rabies.